Hey, there's a place where cancer patients feeling discouraged and overwhelmed with the physical changes can go for help. And this unique place at the University of Kansas Cancer Center is celebrating 15 years of changing lives. Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. Today, we are celebrating Missy's Boutique, an accredited and Medicare-approved appearance center inspired by two breast cancer patients. We are glad you're here to help us recognize this amazing place during Breast Cancer Awareness Month. We will hear from one of the founders and manager, Judith Newell, in the studio today, along with her very first patient turned friend, Gwendolyn Watson. Welcome home, folks.
Thank you for having me.
Thank you.
Good to have you both today.
Thank you.
Judith's grandson, Peyton Newell, is joining us virtually. Good morning, Peyton.
Morning. How you doing?
I'm great. I'm happy to be here. Upright, bipedal, it's awesome. Also joining us is an appearance center worker with unique skills. We'll hear from Sarah Goldbeck about how she helps patients navigate the loss of their hair and their breasts. Judith, for those of us who have been around a while, like me, we all know the great services Missy's provides to patients. Many people walk into Missy's and see a boutique. But you and your staff care for patients in ways the public probably can't imagine. And it all started very personally for you and another mother with girls in the family named Missy. Both Missy's fought breast cancer. Your Missy was your daughter-in-law. Tell us the story of how these women inspired this unique store and this service center.
Well, actually, 15 years ago, all of this took place. It was a dream of two Missys, Missy Malter Newell, Missy Wilcox O'Neill. Because of the journey they was on, at the time, there wasn't a place for one-stop shopping. So this was a wish that they wanted granted. And because of Treads and Threads, many donors and the families came together and we was able to raise the seed money to make an appearance center. And there's so much more than what a lot of people think. When you walk by and you look in, you see retail. And that's because when I look at the pictures of the two Missys hanging on the wall, two things come to mind. Courage that they had because of their strong faith in couture, because they love to shop and they love and they love boutiques. So we tried to capture that as you walk through the door. Of course, the more serious takes place in our two rooms, our mastectomy room and our wig rooms. And we're able, with the experienced, certified, licensed staff that we have in Missy's Boutique, we are able to, what we feel, give back to our patients something that they have lost. And a lot of that is a lot of self-esteem. But it's so gratifying when you see a patient look in the mirror, like Gwendolyn, and the projection they see of their self and their appearance radiates a smile that warms your heart. And so we're happy to be there.
That's a great story and a great service. So Gwendolyn was the first patient you helped. We keep hearing that you keep coming back for the services and the retail items. Do you remember the first time you came to Missy's Boutique and what they were able to do for you?
Oh, yes. Back in 2003, I was diagnosed with breast cancer and colon cancer at the same time.
That's a big deal.
And the breast cancer was HR3 negative, and the tumor was fairly large, and so I was given a 10% chance of surviving in 2000.
Let's say 22 years ago. Come on, high five that one. You got to watch a lot more Star Trek before the show. She's a Trekkie, people. We bonded just a few minutes ago in the original series. So, okay, go ahead.
So for about 4 years, I kind of wander around because my clothes weren't fitting me no more. I didn't want to go to dinner with my family. I was just kind of being recluse, and when I would be out in public, you know, I had big t-shirts because I didn't, you know how to do my bras, the regular bras. And so one day I was at the Cancer Center, Westwood, and I walked by this shop, and I was like, what is a shop doing in the Cancer Center? and I looked, and it was women items hanging all up, and I said, well, just let me go in here. So I went in, and Judith was there, and I was just looking around, and she asked me, can I help you? And I started boo-hoo crying.
I love the way the two of you look at each other. You guys got something going on.
Yeah,
This is the
there's a
friendship. That's
connection.
awesome.
Yes,
Yeah.
Connection.
and I couldn't stop crying. She embraced me and she hugged me, and she said, "What is it?" And I said, I can't fix, you know, I can't wear my clothes. I can't wear a button-up shirt. I can't wear clothes that I feel confident and my self-esteem. And she said, well, you in the right place, honey.
That's great. Yeah.
And so Judith, you know, got me set up with a prescription to get a fitting, and that was 15 years ago. And I tell you, my self-esteem and my dignity was, I mean, skyrocket, you know, on that day.
Yes.
And so every time I come for just a checkup or a bone scan or anything, I always stop by Missy's and I purchase things because I want to pass it on. What helped me, them being here, I wanted to help other women, and I want other women to know that there's a place that we can go to that understands our self-esteem and our dignity, and Missy's is that.
That's a
Thank
great
you.
story.
Missy's
What a
is
great,
thank
what
you
a
for
great
that.
testimony, right? That
I
it doesn't
knew-
get any better than that, coming
Oh, I
straight from the
know.
heart. Straight from the heart.
Absolutely.
Now, Sarah, you've been with Missy's almost from the beginning. You started volunteering 13 plus years ago as a licensed cosmetologist who worked with patients who were losing their hair from treatments, and now you're a Missy's employee and a certified mastectomy fitter. Why do cancer patients need someone licensed to help them? Tell us a little bit about what you do with wig and bra fittings and why you do it.
Well, why I do it, I guess is simple, is I want to help people. That's a simple answer. A simple answer of us being licensed is putting our patients at ease, I think. But I think the more elaborate answer is that we are part of the health system that strives to serve their patients excellent care, and we want to be a part of that. So why wouldn't we be licensed and certified and knowledgeable in what we do? So I feel like they expect that. And so I think that's good for everyone all the way around. For what we do in the wig room is we try to make our women, and mastectomy room, make our women feel more at ease at the journey that they're going through. So it's a transition for everyone. And so we try to make it, I don't want to say lighthearted, but most of the women come in here pretty positive. So I think they're looking for somebody to acknowledge their positivity and try to keep the flow of that going. And hopefully we try to do that for them.
Yeah, and it's such a great story. What do you tell your patients when trying to find the right wig or the right style for them? How do you help them?
Well, for the most part, most women want to look and feel the exact same way that they do on a daily. So I've been doing hair, if you will, for 37 years or more. So I try to accommodate that. I know our styles, I know what's in stock, and so I try to give them what they look like every day, so they feel like themselves every day. So that part is actually fairly easy to make them understand that we're here to make them feel like they always do.
That is really a remarkable, what a great thing, right? It is beautiful, beautiful testimony again. Now, Peyton, you're Judith's grandson. Cancer took your mom away from you at age 4. In this photo, you were just a baby. Your mom would live another 4+ years. And in another photo, you're giving your mom a Mother's Day present. She was in the middle of her chemo treatments by then. You had a very short time with her. You continue to remember and honor your mom. You graduated from Nebraska in 2018, where you were kind of a big deal on the gridiron. And I'm just saying, dude, you were big, man. You were a big deal. Always on the jumbo screen at the games, and now you're in medical sales while pursuing your master's degree here at KU. Tell us a little bit about yourself. What's life like? How you've made your major, and and are you doing okay on the journey from Cornhusker to Jayhawk? Is that going pretty well?
I'm Jayhawk at heart always. So I'm just living life fully, trying to make an impact on everybody around me and uplift people just like we do at the boutique. The girls at the boutique inspire so many people every day, and it's contagious, and I try to live with that every day. Nebraska kind of turned me into who I am today, earned my black shirt there, and now I do medical device sales. So I cover hospitals in Arkansas, Missouri, and Kansas. And actually, I have a surgery right now, and I asked the hospital to let me have a private room. The room is the breastfeeding room, and it's room 417, which is...
Oh, there you go.
So,
I love that.
Just the impact both Missy's and my mom has made, and all the girls there, the amount of women that feel beautiful. No one deserves to live their life questioning how they look in the mirror every day or not wanting to go into public. This place does that. It gives them a smile. It gives them a reason to live. Yes. It gives them purpose. Yes. And those are all things that I know personally my mom represented, and what my family, my stepmom, my grandma especially, have given to me and taught me.
These are pretty special people. You sound pretty special yourself, and you've actually answered the next question I have in my script, but I do want to point out to people that you've raised awareness about breast cancer wherever you go, right? When you were a Cornhusker, you even helped your counselor who was diagnosed with breast cancer. How do you talk about your experience in life, your family's experience, and help these folks who have this really challenging diagnosis?
I think it's just as simple as you're not alone. When we're all here trying to be better every day, to serve, to give, and I think it's simple as that. Like, we're not here for ourselves. We're here to help other people and make an impact in other people's lives, and that's what we do, especially at the Cancer Center. I mean, every hospital I go into, if someone has a breast cancer sign, I swear they've either been to the boutique or had someone that has been there, and that impact is just, you can't explain it. It's truly beautiful.
Yeah, well, it's in my family, and I know that the folks who have also been a part of Missy's Boutique, and it has meant so much. And so, now the question is, are you going to diversify your line into those of us who have been losing hair due to age? And it's, I want to look a little more like William Shatner than Jean-Luc Picard here. I want to be Captain Kirk. I don't have the hair anymore. But what's the favorite wig? Well, what's the favorite hair color you're selling?
Well, actually, Sarah can agree with this. We have something just perfect for Dr. Seitz.
Oh boy, here we go.
I think it's hanging behind you. Isn't it pink and lavender?
Yes, I'm in, man. I'll take it. That's it.
I do have something that way, yes.
That's getting an appointment for him, okay?
I probably need it, so. All right, well, thank you. We're going to go check in with Dr. Hawkinson now and come back afterwards. We'll talk a little bit more with Judith, who's going to show us what is new at Missy's. And we want Peyton to share the story of how this breast cancer symbol ended up on his arm during a big game. You're not going to believe it. Maybe you will. In the meantime, we always take time for your questions. Alexis will be standing by the studio in just a moment. But first, Doc Hawk, what's going on out there? COVID vaccine 19, which shot should you get? Where are we? How much COVID are we seeing?
Yeah. Well, right now, we are in respiratory viral season. RSV, influenza, and actually COVID activities are low. We know that there was an increase in activity 4 or 6 weeks ago. The last 3 to 4 weeks or so, we've seen the peak, and it is decreasing, so that is good news. But we always got to be on the lookout for increasing rates of disease and, of course, unfortunately, hospitalizations as well.
Yeah.
So as far as vaccination goes, we know that RSV vaccines are available. Influenza vaccines are available. It's a good time to go get those right now. And especially here at the health system now, we also have COVID vaccines available for the 2025-2026 updated vaccine. But just as you said, who should get them? And I know that there has been a lot of confusion with HHS, CDC making new recommendations. There was, if you remember the previous 4 to 5 years, there was a universal recommendation for everybody 6 months and older to get vaccinated. Those vaccine recommendations were changed to just those that were over 65 and those who were younger who had increased risk of severe disease. Now, however, as of October 6th, HHS has come out and said that it will be based on individual decision making, and so that is good. That means basically talking with your provider and deciding if you should get that. Which, you should be doing that anyway.
Anyway, that's exactly. I clearly we're in a different spot around COVID. Yet, if you're over 65 or if you have breast cancer or other diseases or significant, it is still a threat, and we still have patients who die from COVID-19. So I think having that conversation with your own physician makes such an important difference. And just say on this program coming up, as we have every year for the last few years, since the shot came out, I'm going to get vaccinated on the program with both my flu shot in one arm, my COVID shot in the other, and we're going to go at it in one of these weeks coming up. And I may not be your personal physician, but I think if you want a COVID shot, because you're around a lot of COVID, Godspeed, man.
No, I'm certainly excited. I definitely want to get mine this year, and we'll be getting influenza vaccine at the same time. But remember, you can get those 2 vaccines at the same time. That is very safe and effective. And we continue to have new data, peer-reviewed, good data, and publications supporting the fact that even the 2024-2025 COVID updated vaccine, even though the uptake wasn't great, it still offered benefit in reducing anyone's risk of going to the hospital, the emergency department, and especially the ICU. So it is vitally important to get that. And just as I said, we have had now just confusion about who is it recommended for after that universal recommendations were kind of thrown out the window. It is individual-based decision making now, but we also should say that the individual medical societies, which are trusted and are the pillars for all of our specialists, whether that's ACOG, which is the OBGYN specialty, that is their main society, AAP as well, which is the American Academy of Pediatrics, and then also AAFP, which is the American Academy of Family Practitioners as well. They have all produced their own society recommendations, and I think we do have a graphic showing what that would be. You can see this here. It is available on the internet. This is taken from Common Health Coalition. Basically, what that shows is it's hard to read. The COVID-19 vaccine recommendation is on that far right corner. Basically, it continues to be that really anybody over 6 months, and of course for children, it's if their parents desire for them to have it, but anybody over 6 months should get it. ACOG, the OBGYN Society, continues to say anybody who is pregnant or thinking about getting pregnant or even in that postpartum period should be getting it. We know that they continue to evaluate the safety. This vaccine continues to be one of the most studied vaccines ever. Over 13 billion doses have been given as of August 2024. Continues to show that there is a great safety profile and a great efficacy profile. And we always have to say that getting the disease is worse than getting any of these minor side effects from the vaccine.
Yeah, you know, and I'll just to say it out loud, I'm a lung doctor, pulmonologist, and take care of a lot of cystic fibrosis patients and post-transplant patients. Absolutely, we're recommending go get the COVID vaccination because the patient population who is at risk. And I think the thing about when you see your primary care doctor or your specialists, they're going to be most in touch with their own societies and how the data looks at patients in your disease category, if you will. It's not a great description, but you know what I mean. If the folks who look like you in terms of the type of diseases you have, so you talk to your primary care doc, you talk to your specialty care doc, get their recommendation. The HHS has moved away from one size fits all to let's be very individualized about it. And again, I'm afraid sometimes this whole COVID thing has turned into a political football, which it should not, because it's about people's lives, not about a darn political game. So that makes me a little upset. But I think that having it, when you have a disease and you have a question about it, talk to your primary care physician, your specialty care physician. They're going to give you the best advice for your personal situation, Hawk.
Yeah, and to that point, you know, one of the tenets of medicine and what we practice is do no harm. And so there is a continual evaluation of any intervention that is undertaken for our patients. Is the benefit greater than the risk? That continues to go on. And just as you had just stated about the specialists are going to be most in tune with the most up-to-date data, this data continues to support the fact that these vaccines are safe and effective, and they are a very good intervention to help reduce the risk and the chance of further disease and going to the hospital.
Hawkeye, thank you. And
Yes.
always a pleasure to see you right
great.
here, man. It's good to be
Yes.
back in the chair with you right there. It's perfect.
And I can't wait till we get vaccinated here in a
I
week or two.
know. Okay, guys, we got to make sure we got that going.
Yep.
All right, Judith, Missy's is getting ready to open a new location at Olathe. Now, that's a cool thing. We have a big cancer program that's developed in Olathe now. It's part of the University of Kansas Health Cancer Program, so that's great. Both the locations there will offer inspirational clothing and jewelry that make great gifts for cancer patients. Tell us when you hope to open up that Olathe location.
Well, actually, we was open for a short while, and it was to bring awareness to the community about the services that we do. With that being said, we will open officially probably the first part of the year, along with Liberty. And so,
Great. Liberty and Olathe, yes.
Yeah.
William Jewell College, my alma mater.
All right.
I don't know if they want to claim me or not. Wisely, they probably don't. But I did go to Liberty for 4 years, so that's great community too.
Yes, so we are very pleased that we've been able, with the support of the Cancer Center, to be able to cross the river to help those women out north that don't seem to want to come this direction.
Yes.
And the ones out south.
That's awesome.
Yeah.
You know, because the state line's one thing in this area, but the river's a different one. I'm not sure which one's bigger as far as separating people sometimes.
Yes.
So, all right, now do the Olathe Liberty stores, are they going to offer the same fitting services as the Cancer Center in Westwood does?
Yes, they're going to be a mirror of what we have here. So everyone can expect the same.
And I know that's going to make you feel good to know that this is getting extended.
Absolutely, absolutely. More women will be helped, and I just keep saying our self-esteem and our dignity. When you lose that as a woman, I love being a woman.
Yeah. I think we can celebrate you. Really, can she come back?
I love being a woman. I love all the curves and everything. And when we as women lose that feeling, then it affects our family, it affects our life, it affects everything that we touch. And then to have a boutique and people in the boutique that understand us and support us, that's awesome. That's great. And I just can't, say enough about Missy's Boutique, how much it has, helped me. I had cancer 3 times.
That's a lot.
3 times.
You don't want to have any more. You've done your part.
No. In 2022, they found the 3rd cancer, and my cat found it.
Your cat.
Pearl.
Okay, well, Pearl's a new diagnostic tool here.
There's Pearl. Hello.
Hi, Pearl looks like my cat. I have a cat named Hoshi. Looks like the same kind of coloration.
And one day Pearl just walked across my chest. She was a little cat back then. And I was like, ow. that hurt, Pearl. And then I thought about it. I said, wait a minute. I said, that shouldn't hurt. So I called the cancer center, and they told me to come in, and we got the mammogram and everything, and the radiologist was looking down at me on the table, and they said, how did you know you had cancer? How did you know? And I told them, I said, well, I didn't know I had cancer. I said, but God did, and God told Pearl to tell me.
Hey, cats are smart creatures. My cat's very smart. She worked out with me this morning.
Does your cat ring the doorbell when she wants in?
No,
Pearl rings the
My
doorbell.
cat just screams at me the moment I come home and like, pay attention to me. Not to my wife of 39 years, but to me. All right.
Maybe we should hire Pearl.
Yeah, that's it. Maybe Pearl wants a wig. So Missy's has no doubt grown and changed over 15 years. Earlier we asked you to show us around the store, which is nestled inside the Cancer Center in Westwood. If you've never been to Missy's, here's a sneak peek.
We have had some good changes in here, especially for our patients, and that's what this facility is all about. It's for our patients. One of the big changes is we've been able to open it up more because we have these different display cases. We can get around in wheelchairs, they can move in and out, and that was a big thing. Our wheelchair patients could only come to maybe this far, and that was it. And we'd have to go and get product and bring it to them, and it just wasn't fair to those patients. And so I have had a lot of good feedback about this. Another thing is we're not cluttered. Coming on back here a little ways, we now have a sitting area for our patients and their visitor, which is very important because usually when our patients come, they don't like to go through this without having a loved one or a good friend with them. So now they can go into the room. If there's two, then the other one can sit out here. We are very active with both rooms. This is our wig room, and you have to excuse a little bit of the file sitting around because we now have really gone uptown, and we are on electronic filing, which is fantastic. Our next room, of course, is our fitting room. And I have to show you our new painting in there. Was done by Sheila Gadwood. She lives in Florida. She painted that especially for this room. We all like to think, you know, this is a classy place and we don't share much outside of these rooms. And so that's why the shh. We like to think that Missy's Boutique is the bright light towards our patients' recovery. These are all fantastic things that have happened. It's taken 15 years to get here, but it's so worthwhile because in the grand scheme of things, 15 years is not a long time.
Or 22 years for your kids, right? So now, Peyton, this next story gave me goosebumps, and you showed us your arm a little bit ago, but tell us a little how and when this breast cancer symbol showed up on your arm during a football game.
That actually happened my very first career game at Nebraska. My adrenaline was going, 92,000 fans. So I really didn't realize it. And then after the game, I was sitting in my locker, taking my tape off my wrists, and I looked down and I was like, just in shock, but it made me happy, honestly. It's not the impact that my mom and the University of Kansas, and thank you guys, by the way, because of you guys, we are able to serve and give over 26,000 women to feel beautiful, like we talked about earlier. I mean, it's just so special, the impact everyone's made and the connection she has with me. I don't know which part of heaven she's in, but she communicates with me every day, and just very fortunate the amount of lives we've impacted through her legacy.
Peyton, that is a beautiful statement, and I just, golly, that's, okay, let's head over to Studio B with Alexis. Alexis, I've been close to tears here a couple times this program. I'm going to hold it together, though.
Such an amazing story. Jeremy Yenser has a question. Jeremy writes, I imagine giving cancer survivors some feeling of control again after having so many experiences in their cancer journey where they can't really control or change anything that's happening to them is really empowering. I just want to say kudos and thank you so much for helping them. So that was a comment from Jeremy, one of our loyal viewers.
That's a celebration. I like it.
Kim Bosley Moore wants to know, will insurance companies pay for the wigs after chemo treatment? And does it have to be prescribed by their doctor?
Okay, team.
I'll take that question. Yes, universal insurance companies, most of them do pay for the wigs. What we need is a script from the doctor stating that that is something that they need. And so we're happy to file insurance for our patients.
Joellen has another question. This is a great question. She writes, I have a young friend in Topeka who is a mother of a toddler battling breast cancer, but not a patient at KU. So could my friend use the services of the boutique?
Yes, indeed, because actually here at the University of Kansas Cancer Center, there are no boundaries. We help everyone, and happy to do that.
And then I have just a comment from Lisa Hunter Howsam. She writes, as always, great to see Dr. Stites and Dr. Hawkinson on the program. I really trust Dr. Hawkinson's advice. Got both my flu and COVID vaccines.
Awesome. I love that. I love that. Guys, this has been a great discussion, and I just want to say how grateful I am to our guests for being here.
Thank you.
I want to hear final thoughts before we go, and we'll just kind of go around the horn here to do that. Peyton, final thoughts.
Just thank you guys for everything, and you make an impact. My grandma's going to get mad at me for saying this, but she's 80 years old, and the passion you can see in her voice and her eyes, and with Sarah, that's the service you get there at the boutique. It's not a sad thing or a sad place to go to. You literally, if you're hesitating on going or wanting to go, the only thing you have to do is go there and feel beautiful. So thank you guys.
I love that. Sarah, final thoughts.
Thank you, Peyton. I appreciate the shout out. I feel like my final thought would be, we try to make it a safe place for everyone to come. I want them to feel every emotion that they want to feel, but I want them to leave on a high note every single time they leave. So I hope we do that for them. I do have one more thing to offer, though. We did not find the pink wig for you, Dr. Stites, but I did find a nice
I'll
curly
look
red
good.
one for you.
I'm going to look good. Thank you. Any and all help is welcome. That's brilliant. I'll show that at my wife will throw me out of the house.
So rock star.
Yeah, rock star. That's what I meant. Yeah, that's what I meant. You don't want to hear me sing, you know? All right. Gwendolyn, final thoughts.
My final thoughts are that you need to keep your joy when you're going through. You know, you're doing all that you can do as the patient. The doctor is doing all that he can do, and God is going to take the case up and do what needs to be done. But God said, keep your joy. Even though you're going through, keep your joy.
Yeah, I love that. That's awesome. Final thought.
Oh, gee. There's so many of them. You know, I've been doing this for a long time, and I agree with Gwendolyn that we are all placed here for a purpose. And long ago did I realize I would end up here with this purpose. And so I'm very thankful that I've been able to do what I have done. And I like to say, in Missy's, you get the personal touch.
Yes.
That's great. You know, folks, we talk a lot about faith, hope, and science in this program, and faith can be a very individual story, and we heard some great individual testimony today about the faith, the impact of faith in people's lives. Hope is one of the most powerful parts of medicine and healthcare. Whether it's hope even in the most terrible of circumstance or even at the end of your life, having hope that you'll be okay, and those around you who you care about will be okay. Hope is forever powerful, and science, which helps bring us all together in the search for trying to help each other.
That's right.
You know, science can do a lot, and together, you put those three things together, I think you find a little joy out there.
Hallelujah.
So let's go find some more joy.
Hallelujah.
Let's
have church.
Let's have church. Faith, hope, science, and together we'll find a little joy. We'll see you next week.
I'm Alexis Del Cid. On the next All Things Heart, he's not even 30 years old, and Keith Holmes Jr. is already on his second heart valve. We take you with us inside the cath lab and watch doctors replace it without ever opening his chest. Thursday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.